Hi, my name is Steve Hedrick, and I'm a plastic surgeon from Austin, Texas. Today I'll be discussing a recent PRS article entitled Utilization Trends of Nerve Autograft Alternatives for the Reconstruction of Peripheral Nerves. First, I'll look back on how we fix nerves. If a nerve is cut sharply, say on broken glass, the nerve can be sewn back together directly. However, if it's not a sharp cut, say from a chainsaw, there will be a gap in the nerve and the surgeon will have to bridge that gap with something. The gold standard is to borrow a nerve from a less important part of the body, most commonly from the lower leg, and use that nerve to bridge the gap in the more critical part of the body, such as the hand. This is called an autograft. This can work very well, but it leaves a scar and a numb spot at the site where the nerve was taken. For this reason, surgeons have sought an alternative that doesn't require damaging another part of the body. The first alternative was to use a tube or a conduit that would create a path for the nerve to grow across the gap. These conduits are usually made from collagen and have become quite popular because they are readily available off the shelf. And although they might not be as good as allografts, they can work reasonably well for short gaps. Recently, a new product became available, nerves harvested from cadavers. We call these allografts. Studies show that they work better than conduits and maybe even as well as autografts. And the point of this study was to assess the trend of utilization of these techniques over a recent 5-year period. The authors used a health insurance database to determine how often each procedure was billed. They found a significant trend away from conduits and autografts and toward allografts. This makes sense given what we know from clinical studies of these techniques. Conduits are still popular because they eliminate donor site problems that are relatively inexpensive. Allografts are appealing because they work better than conduits and maybe even as well as autografts. However, there are big differences in cost, with allografts being by far the most expensive. Autografts don't cost any money per se, but they do carry the cost of numbness at the donor site. So, the financial implications of autograft versus allograft are complicated, and this paper helps set the framework for analyzing these financial implications, with the ultimate goal of optimizing the overall value of nerve gap repairs.